Hi everyone, today we're covering the examination of the accessory nerve, which is the 11th cranial nerve. The accessory nerve is a motor nerve, so very important, it's a motor nerve. Now, it is formed by the union of cranial nerve and a spinal root. So this is very important because accessory nerve, obviously, it's a cranial nerve, so it has a union of cranial as well as a spinal root. Now, since I've told you it's a motor nerve, what are the muscles it supplies? So very important, it supplies the sternocleidomastoid as well as the trapezoid muscle, trapezius muscle, right? So motor nerve that supplies sternocleidomastoid as well as trapezius muscle. It's 11th cranial nerve. It's formed by the union of cranial as well as spinal root. The cranial root arises from the nucleus ambiguous, which is present in the medulla oblongata. The spinal root is formed from axons of nerve cells in the spinal nucleus, which is situated in the interior gray column of the spinal cord, so interior gray column of the upper five cervical segments. The spinal root enters the skull through the foramen magnum. Obviously, when here joins the cranial root, both root leaves the skull through the jugular foramen. So they asked you about jugular foramen. So jugular foramen houses accessory nerve, very important. So now you know that its spinal root it comes up from foramen magnum, obviously, and here it joins the cranial root, and they both join together the cranial as well spinal root, and they leave the skull through the jugular foramen. Now here again, as they're leaving the jugular foramen, they'll again get separated, and the cranial roots are going to join the vagus nerve, and the spinal root supplies the sternocleidomastoid and trapezius muscle. So the cranial root is going to join the vagus nerve, which is the 10th accessory nerve, 10th cranial nerve, vagus nerve. That's the reason it's called accessory nerve. And its spinal root is going to supply the sternocleidomastoid and trapezius muscle. Sternocleidomastoid, if you move your head to the right or left, you're going to notice this muscle that stands out. You can touch it. Sternocleidomastoid has two heads, right? It has a sternal as well as a one head is its a sternal head and other is a clavicular head, right? Now sternocleidomastoid, between both the heads, if you want to palpate your carotid artery, you can palpate it between both the heads of the sternocleidomastoid. So that's the pulse, right? Carotid artery pulse. Now trapezius muscle is also the muscle with which you can shrug easily. Now, what's the examination protocol? Obviously, first of all, you have to ensure that your hands are sanitized. You have to approach the patient from the right hand side. You have to introduce yourself to the patient. You have to explain the procedure to the patient and reassure them that they're not going to be feeling any sort of pain and they'll be safe during the examination. And then you have to take their consent. The accessory nerve, as I've told you, it is a motor nerve entirely. It supplies the sternocleidomastoid as well as the trapezius muscle by the means of its spinal root. Now, the patient should be asked to rotate the head to one side against resistance. So, you're going to provide resistance, and against the resistance, the patient has to rotate the head, causing the sternocleidomastoid of the opposite side to come into action. So, for example, if you rotate it towards the right side, so the sternocleidomastoid of the left side is going to become very much into action. It's going to get into action and it will be very prominent. The patient should be asked to shrug the shoulders. So if you ask the patient to shrug the shoulders, that way the trapezius muscle is going to come into action. So that's it. These are the two tests. One is to shrug and the other is to rotate the head against resistance. You're going to provide slight resistance and you're going to see the sternocleidomastoid on the opposite side will be prominent. And if you ask the patient to shrug the shoulders, if they can shrug properly, it means the trapezius is very much working. It is obviously in action. Lesions of the spinal part of the accessory nerve will result in paralysis of the sternocleidomastoid as well as the trapezius muscle. The sternocleidomastoid muscle will atrophy and there will be weakness in turning the head to the opposite side. The trapezius muscle will also atrophy and the shoulder will droop on that side. There will also be weakness and difficulty in raising the arm above the horizontal, because trapezius work is to also raise the arm above the horizontal, so above the horizontal level. So the two things. If there is a lesion of this accessory nerve, this 11th cranial nerve, the person cannot rotate their head, right? And also the muscle will atrophy. So the sternocleidomastoid muscle will atrophy and there'll be weakness in turning the head to the opposite side. And the other thing will happen is the trapezius muscle. The person cannot shrug the shoulders, instead they're going to droop. And the other thing is obviously the muscles will atrophy and a person cannot raise the arm above the horizontal level. This is examination with the accessory nerve. So again, a quick recap: accessory nerve, the 11th cranial nerve, it's a motor nerve, and it is formed by the union of cranial nerve and cranial root and spinal root. The spinal root comes up through foramen magnum, and as it comes up through foramen magnum, it is going to join with the cranial root. They both unite. These leave the skull through the jugular foramen of, or you can say jugular foramen. Jugular foramen contains accessory nerve. Then, as it exits, again they separate into spinal and cranial root. The cranial root is going to go and supply the it's going to go and connect with the weakest nerve. That's the reason it's called accessory nerve, and the spinal root is going to go and supply the sternocleidomastoid and trapezius muscle. Examination protocol, first of all of the introduction, consent, and all of that, and then you have to ask the patient to rotate the head to the opposite side, and the sternocleidomastoid of the opposite side will be prominent. And when you're asking him to rotate the head, him or her, that would be against the resistance. You're going to supply some sort of resistance. For trapezius, you just have to shrug. If there is lesion, so patient cannot, for example, if the sternocleidomastoid is not working, so obviously there will be atrophy of sternocleidomastoid muscle, as well as the patient cannot turn the head to the opposite side, there will be weakness, there will be difficulty. Other than that, for trapezius muscle, what will happen? The patient obviously shrugging is far off the corner. The person can't even lift anything at all. So it will be, the shoulder will completely droop. There'll be atrophy, and also you cannot raise the hand above horizontal. So this is examination of the accessory nerve.